Massive fire broke out at the Indus Hospital in Visakhapatnam. Police and the firefighting teams rushed to the hospital. In fact, patients were successfully rescued out of the hospital. My colleague Uma Sudhir has more.
This is a 15-year-old hospital, 5 floors, and the fire in fact broke out in the operation theatre on the first floor. And it was not a fire, it was in fact a smoke. And thankfully, all patients, including the emergency patients, including a patient on ventilator and including a patient who had just been operated upon, have in fact been rescued. I have with me the managing director of the hospital, Dr. S. Sridhar. Dr. Sridhar, in fact, Vishnu was operating on a patient, and soon after he finished the operation is when his staff told him that there was a smoke that they saw coming out of one of the panels.
Yeah.
What happened?
They told me that that panel is not working. We called maintenance department. Electrician came, and when he saw there is a smoke coming out of the panel, he informed the security people immediately, and doctors around him, and everybody tried to extinguish that fire with fire equipment available within the premises. And they are not. There is no fire, but smoke. They are not able to control it. And they are not able to, they feel so discomfort, they came out, and we don't know what happened at that time. And our priority at that time is to evacuate the patients. We evacuated the entire hospital within...
17 patients you told me were in the critical care
17
unit.
patients are in critical care department, and we evacuated them first. And we evacuated some of the other patients, and some of the patients came out on their own. We are having a fire ramp, that's why it's easy to evacuate them immediately within the short time. And there is no problem, there is no mortality or morbidity in this. There is some discomfort with our employees. They recovered within time very easily.
This is in quite a crowded area actually, but there are hospitals nearby, Medicover hospitals on either side. There are other private hospitals, KGH hospital as well. What the doctor was telling me also is that this is a national accreditation board hospital. So it had the fire safety. What is important to note here, Vishnu, is that doctor was telling me that because they have carried out fire drills in the past as well, that's the reason the staff was so well trained that they were able to get out all the patients in time. You were telling me about a patient on ventilator who you brought out. How did that happen?
Yeah, we brought out the patient through the ladder immediately because he is not able to move, and immediately we shifted the patient to the other hospital, and he is stable at present. And actually during fire we received a message in PA system that there is a code red. We thought it's a code blue. It's a routine for whenever there is a patient is serious, we get a code blue. I thought it's a code blue, and I came out, and when I came down I saw that it's a code red, and I thought it's a drill, but it's true, real one, and our staff and everybody reacted within a time, and we are able to save all the patients, and we are able to do something to the patient.
Dr. Sridhar himself in fact was operating on a patient, and he had just finished the surgery when he was alerted about it. How was your patient, because he must have also been under medication still?
Yeah, he recovered well, and we shifted him also. He is on medication, and we shifted him to other hospital, and he is stable, and he is walking around also now.